So I'd like to share this particular phase 2 study of Bomedemstat in treatment of myelofibrosis. And in particular, these were the patients who failed the approved therapy, mostly JAK2 inhibitors, mostly ruxolitinib, and some of them fedratinib. So just a bit of a introduction. Bomedemstat is an oral irreversible inhibitor of the enzyme LSD1. And LSD1, as we know, it regulates differentiation from megakaryocytes, it maintains these malignant population of stem cells. And so what we postulate is that inhibition of these malignant stem cells that harbor these driver mutations would actually suppress the pathologic features of myelofibrosis, as well as the symptoms that we see in myelofibrosis. So this study actually completed enrollment in May 2021, and with 89 patients recruited. And I mean, this data is on a cutoff from 29th of April. And so the primary objectives were actually to assess the safety and tolerability of Bomedemstat and its capacity to reduce the spleen volume and improve symptoms, some of the major sort of primary endpoints that we see in other studies. And we also, as some of the secondary endpoints, also assess the impact on the inflammatory cytokines, as well as the blood counts and the mutant allele frequencies of the driver mutations and also other high molecular risk mutations. And 83% of these patients had a previous treatment with ruxolitinib. 70% also received a second treatment with an unfavorable response. And 37% of these patients actually were transfusion dependent. They received one or more transfusions prior to enrollment. And first from the safety perspective, it's basically a very well tolerated drug. The most common hematologic toxicity was thrombocytopenia. But that was expected because our goal of titration was to suppress the platelet to around 75. So we expected that particular thing. The commonest non-hematologic toxicity was dysgeusia, is an alteration in the taste sensation. That was reported in 33%. And in one patient, he had to discontinue due to this taste sensation. And other serious adverse events were mostly either related or remotely related, like cellulitis, pneumonia, and diverticulitis. There were no deaths as such. The efficacy endpoints, basically in terms of the spleen volume reduction and the total symptom score. So at 24 weeks, 64% as a reduction in the spleen volume. Right? And around 6% of these patients had 35% or more reduction in spleen volume. And also, 65% of patients had symptom reduction based on the MPN-10 symptom assessment score. And in around 20% of these patients, the symptom reduction was more than 50%. And as well as I mentioned about patients being transfusion dependent and so on. So at 12 weeks, in fact, 44% of patients had an increase in the hemoglobin of 1 gram per deciliter or more. And 21 patients, basically of the 21 patients who had reduction in the transfusion burden, 3 of them actually were transfusion independent. So that was a bit impressive just based on this particular observation. And fibrosis, as far as marrow fibrosis is concerned, 85% of patients had a stable or improved fibrosis of at least 1 grade or more. So it achieved, within a short period of time, a fibrosis stabilization and even some improvement in the fibrosis. And one of the inflammatory cytokines, CCL5, or the chemokine ligand 5, had a reduction in the measurable concentration. As well as the gene mutations was concerned, 52% of patients had a reduction in the mutant allele frequencies of the driver or the non-driver high molecular risk mutation. And AXXL1 mutation was the most sensitive mutations to Bomedemstat as far as the mutant allele frequency reduction is concerned. So I think that's the sort of key finding. So in fact, to conclude, it's safe and tolerable. a drug for these patients with advanced MF failing first-line therapy. In addition, we did see some improvement in the primary endpoints, as well as improvement in some of the secondary endpoints that actually may mean a disease modification, such as fibrosis stabilization or improvement, and also reduction in the mutant allele frequencies. And one important point is also improvement in the hemoglobin. That might infer a restoration of normal erythropoiesis. I think that's an important point. So I think that's the thing that I want to share on this particular study.